Many cancer patients often ask, "Can I get vaccinated while undergoing chemotherapy?" In reality, there are only 4 common vaccines that cancer patients usually receive: the pneumonia vaccine, the influenza flu vaccine, the COVID-19 vaccine, and the shingles vaccine. Before discussing whether to receive these vaccines and when, it's important to understand the difference between live vaccines and inactivated, killed vaccines. Inactivated vaccines. As the name suggests, these contain killed pathogens. Since they are not alive, there is virtually no risk of infection after administration, and side effects are generally mild. Live vaccines. These contain weakened but living pathogens. Because they can still infect cells, the risks of side effects or complications are higher. The rule of thumb: inactivated vaccines are considered safe and are generally permitted after completion of chemotherapy. Live vaccines carry higher risks and should be avoided during chemotherapy. Breakdown by vaccine. Influenza flu vaccine. This is an inactivated vaccine. Even during chemotherapy, as long as your overall condition is stable, you can safely receive it at any time. However, if you are on active chemotherapy or just completed chemotherapy, you must consult your oncologist. COVID-19 vaccine. These are either mRNA or vector vaccines, which function similarly to inactivated vaccines. Like the flu shot, this can theoretically be given during chemotherapy if the patient's condition is not severely weakened. In most cases, you will need to discuss the benefits and risk during therapy with your oncologist. Shingles vaccine. This is a live vaccine and should never be given during chemotherapy. It is recommended to wait until chemotherapy has finished and then receive it about 2 to 3 months afterward, provided the patient's condition is stable. This would require your oncologist to evaluate your case post-chemotherapy has been completed and your immune system had enough time to recover. Pneumonia vaccine. While this is an inactivated vaccine, the general guideline is to administer it a few weeks before starting chemotherapy rather than during treatment. This is especially important for patients with lung cancer or those receiving radiation therapy to the chest, since their risk of pneumonia is about 10 times higher than the general population. Pneumonia can be life-threatening, so preemptive vaccination is strongly advised. So please discuss with your oncologist if pneumonia vaccination is right for you, as each patient carries different risks and benefits for judicious decision-making. Knowledge is power. Stay informed. Please like and follow for more cancer education.